Mother Knows Death, starring Nicole and Jemmy and Maria Q. Kane.
Hi, everyone. Welcome to Mother Knows Death. Today, we're going to talk about one of the Menendez brothers being hospitalized with a serious medical condition, a TikTok trend that leaves a girl in a coma, a terribly frightening new fear relating to staying at a hotel, and yet another story of a patient having the wrong organ removed. All that and more on today's episode. Let's get started with Erik Menendez.
All right, so as we've discussed at length on here, the Menendez brothers are still waiting to see if they'll be released from prison. So now it's a couple weeks away from their parole hearing, and Erik Menendez has unfortunately been hospitalized with severe kidney stones and has required multiple surgeries for it.
Yeah, so normally a lot of times, people that have kidney stones all the time. Like Louis had, or my brother had one last year, and it seems to be a very terribly painful experience. And you go to the hospital and you pass it and you move on, and you're just like, okay, that's not a serious medical condition. But in some circumstances, people could get really, really bad kidney stones to the point where it actually fills up their entire kidney and requires surgery to be removed because they're just too large to pass. So in this case, he had large kidney stones in both kidneys. And what happens is that these stones can form, they're called a staghorn calculus because they take on an appearance of almost looking like an antler because the stone actually grows within the kidney. And you could see all of the nooks and crannies of the kidney called the renal pelvis. So when you pull this stone out of a kidney, it looks like you're holding antlers, basically.
Wow.
Yeah, they're really like beautiful stones to look at, actually. I've seen a couple in my career, but these particular stones usually form because of certain bacterial infections in the kidney that could just cause crystallization of these certain chemicals and proteins. And what happens is it calcifies or gets really hard in the kidney. And then all of the urine that's created in the kidney has a hard time getting out because it's blocked in the opening by the stone. And when that urine starts to back up, it can make the kidney get larger, which is called hydronephrosis. That just means like water in the kidney, basically, which is just like essentially pee filling up in the kidney. And over time, that could turn into pus and an infection. And I mean, this could kill him. Like, it is very, very serious. And the fact that he's had to have so many surgeries, because you have to have one good kidney, and if they're both kind of acting up, it could be super, super serious. So that's why he's hospitalized, because it's really his life could be a danger from becoming septic and possibly dying from this.
Can you imagine if they get out and then he ends up dying from this like shortly after or something?
So let me tell you, because I guess I'm just kind of like out of touch, obviously. When I read this article, I'm more shocked about anything is that it said his daughter released that he was in the hospital. Like, when did he have a kid?
It's not his biological daughter. It's his wife's daughter.
Oh, okay. Because I was just like, wait a second. Because I thought, and this is like side note, I just read something that like Brian Koberger, I guess in theory, could get married in prison, but he's not allowed to have conjugal visits.
I hope not. I don't ever want to hear about
That's why
this.
I was wondering, like, well, are Menendez brothers allowed to have them? Like, how was he able to have a kid if he didn't have a kid when he entered? But okay, that makes sense.
I honestly do not know if they can have conjugal visits or not. They're both married. I believe the brother has been divorced maybe twice for having affairs or something. Like, he's always like talking to other people.
What if he gets out? Like, what if he gets out and the wife like isn't physically attracted to him like that?
I think that happens a lot, actually. Like, there's these prison brides. There's a Lifetime show called Prison Brides. I actually started watching it. I was really into it. I want to get back into it, but
it's interesting, right? Because I feel like the way like a guy smells and like stuff like that is just like important for things. And if you don't get to have that kind of intimacy, like what if that you don't like that?
Well, there's this psychology too that women date prisoners because they have like major trust issues and they're locked up, so they can't really like do anything. And then when they get out, well, when they get out too, it's like he's been in jail since what, 19 early. I think the crime was in 1989, but they weren't on
You're
trial
saying
until
trust
94.
issues like cheating because they
Yeah.
can't. Yeah, which they still can have multiple relation. All right, we're getting
Anyway,
sidetracked
what I'm
here.
getting at is he's been in jail since at least the early 90s. So he hasn't experienced life for so long, right? Like, he might not want anything to do with her when he gets out because he's like,
Yeah, right.
I haven't even been part of the world and all this technology and all this stuff. I would guarantee they get a podcast when they get out because
Oh yeah,
that would be enormous for them. Why wouldn't they do that and make all the money themselves? And I'm sure they'll get paid a hefty fine or a hefty salary
so
or something if
they
get.
can't do anything like that now. I
No,
guess
but you
not.
know what really scared me is that I read that in the prison that Koberger's in, they could buy like a tablet that's preloaded with apps so they could listen to podcasts and stuff. And I really just hope he never comes across ours.
Ours is low level compared to what other people are talking about with his case.
I know, but we
doubt
probably have like 15 episodes with his name in the titles.
he don't care. We're small potatoes.
Stay away from us.
He just wants to be like infamous, and he's not getting there from us. So
Yeah,
Um,
so confirmed it's not his biological daughter, it's his stepdaughter, but I understand where your confusion was coming from. Okay, so last fall, a 7-year-old girl was attempting to do a TikTok trend with a squishy toy when suddenly it exploded, leaving her in a coma.
so do you know what this squishy toy is called? It's called a Nido.
I wasn't
Lillian's had
familiar.
them.
All right, well, I wasn't familiar with it, but it was something when I looked at it, I was like, I'm sure Lillian's had it or wants it because it's
Yeah.
right up her alley.
Yeah, exactly. She used to get them all the time, and it's like a rubber ball that seems like it's filled with like almost like shaving cream or something. It was like very squishy. I guess they're filled with all different sorts of stuff. But this TikTok trend was like I'm so annoyed by this case actually. It's like put it in the freezer and then put it in the microwave to get it to be more malleable or whatever. So the kid puts this thing in the freezer and the dad said, "Why did you put that in the freezer?" Listen, like some of this I'm reading it and I'm like this happens to me all the time. Gabe can definitely say that this happens in our house that you open the freezer and there's like some weird shit in there that the kids it's usually some weird concoction of like you're like what's that brown shit in the cup in the freezer? Like what are you doing with that? It's always something and you're like it's just hilarious, right? So the dad's like, "Why is this thing in the freezer?" And then he didn't really think anything of it. So the kid puts it in the microwave and opens the microwave and the thing freaking explodes, essentially like hot liquid glue all over her face. And you know, if you have hot glue on you, like he said that the dad heard a blood curdling scream and tried to get it off of her and he couldn't get it off of her because
Oh
it was
my
sticking
God.
to him and it was sticking to her everywhere. Brought her to the hospital, which was a half hour away. So I don't know if they were living in a more rural area that it would be quicker for them to drive rather than to call an ambulance. Like, I'm not sure. But she got to the hospital and they put her in a medically induced coma and gave her a tracheotomy tube because they were scared that her airway was going to get so swollen because she got burned around her mouth and inside her mouth so much. They were like, we're going to put her in a coma and just let her swelling go down and like let her breathe through this right now. Which is just so scary. Second, third degree burns. For a while, they were talking about giving her skin grafts and they decided against giving her skin grafts. But the mom is just like, she's probably going to need something in the future because she's disfigured because of this.
Yeah.
And I guess the most annoying part of this article was that they somehow were able to contact both. So I guess the kid didn't have a TikTok because the first thing I did was sent the story to Lillian and she's like, "Why does a 7-year-old have TikTok?" And I'm just like, dude, it's because the people got smart and they know little kids aren't allowed to have TikTok most times. So then they put the same videos on YouTube. Like, so the kids saw a TikTok video on YouTube.
Okay.
So TikTok, first of all, said they don't allow content that shows or promotes dangerous behavior.
Bullshit.
Bullshit, because we have a story of this like once a month at least of some kind of TikTok thing that went wrong and a child getting seriously injured or dying. So that's bullshit. And then YouTube said they kind of basically tried to turf it and said kids aren't allowed to use YouTube until they're 13 or older, and they should be monitored by a parent, which is their protection, because it does say that. And they also said that they don't allow things like that. But you're just like, okay, well, you're like gaslighting me right now, because my kid just saw it on your platform from the other platform that said you guys don't do it. You know what I mean? So like,
Uh, I don't know. I agree with YouTube in the sense of saying like, well, we do say you can't watch it. It doesn't mean people don't do it, but that is in their guidelines. But TikTok is ridiculous for saying that, because that might be in their guidelines, but they're certainly not monitoring it. Like, how is YouTube going to monitor a child watching it on their parent's device? They don't know if a 7-year-old or a 35-year-old's holding the phone. But TikTok can certainly take the videos down, and I see shit every day I'm on
yeah, but
there.
the same thing could be said about YouTube too. Why can't YouTube?
Well, they can take it down too, but they didn't say we don't show harmful content. They just said you shouldn't be watching it unless you're 13.
Well, yeah, and I mean the same could be said about Instagram, because I remember for a while people like yelling at me and being like, "My 10-year-old saw this and it's disturbing," and I was just like, "Why the hell is your 10-year-old looking at my Instagram account or on Instagram not being monitored anyway? Like that's kind of not my
Yeah,
problem."
that's a parent problem. Like that's why I'm saying with YouTube, it's like I think it's dick to make a comment like that, but at the same time, like you can't monitor the age of the person holding the device, especially if it's on the parent's account. Not to say that adult stuff and harmful stuff can't get on the kids side of it, but I'm just putting that out there. Also, I wanted to say not to sound like a boomer, as the kids have been loving calling me the past couple of weeks, but back in my day, there used to be a YouTube channel called Is It a Good Idea to Microwave This? And it was these people that microwaved all these different types of objects in, I don't want to say a controlled environment, but they were prepared for explosions or things catching on fire. And I think that satisfied the needs of a lot of young people doing it themselves. And that channel doesn't exist anymore. And maybe if they still existed in the
Yeah,
day and age
probably
of
because
squishy stuff.
somebody got burned and put some shit in. I You know what? The problem with kids is that you just never know. You never know what they're going to do that's going to be like not a good idea. And like I'm telling you, like 2 days ago, Lillian's like, "Mommy, you're gonna kill me. Why? You're gonna kill me. You promise you're not gonna be mad, okay?" And she comes downstairs and like she decided to like trim her eyebrows, and like they're like missing huge chunks. I don't even understand why she touched them, because they're like perfect in my opinion. And she quickly realized that they didn't look good. You know, like it was like, oh shit, why did I do that? Like kids just don't think ahead.
No.
I mean, I think a lot of us sitting here right now could be like, oh, we got this haircut and then that was a bad idea or something. Like
Never
adults do it
forget
too,
when I trimmed all my baby hairs.
which wasn't that long ago.
No, that was only like 5 years ago.
Yeah. She like we were at Morning Glory Diner, and I look over at her and like see we all have these like hairs. For those of you that are looking, like our hairline starts like way further back because we have like baby hairs, and Maria's like looked like a razor went to them, and I was like, "What did you do?" And
All
she's
right,
like,
so I
know that piece gets on your nerves, but like get it lasered
well, I was
if it
I was
really bothers you.
25 years old and broke working at a restaurant. Do you think I have money to get it lasered?
You were just recently complaining about it though.
I do hate it. I should go get it lasered. Will Dr. Dimitri do something like
Yeah.
that, or I have to? All
Oh,
right.
absolutely, he'll do it.
I'll talk to him. Anyway, I was at my friend's wedding and the pictures came out like a couple weeks later, and my baby hair was like plastered to my forehead, so it looked like I was like super greasy and sweaty, but that's just how it gets. It like right now, the fact that it stayed like this is a miracle. Like it's typically like it has a mind of its own. It just goes wherever it wants. It doesn't matter what I do to my hair. But it kept happening to me in pictures, and it was, in my opinion, making me look like I was like had greasy hair or something. But it's just what happens, and it pissed me off. So right before thank God COVID happened, so I could hide in my house while it grew back out. But I cut it, and it looked weird. I don't recommend it, but yeah, maybe.
It did.
What if
look
that
weird.
happens when I get it lasered? If it looks weird.
No, I think that lots of people get, because it, like, I can't explain it to you, but when I'm looking at you right now, it's like you have the part and then there's like this little squiggle wave and then it goes straight. Like if you just remove those little hairs along that line, like it'll just look like you're trying. This is the problem. Like you have curly hair like I do. And whenever I used to try to wear my hair straight, I had the same problem because I have baby hairs that are curly, and it's just like it doesn't go with the look you're trying to go for.
No, see, all right. So see how it's sitting now? Like that's fine with me, but a lot of times it'll be like, now I'm gonna mess it up. It'll be like,
See, when you wear it, when you don't
it'll
wear
be
it,
like that, and that's what bothers me.
yeah, like
Because
I
it'll
feel
be
like
a line.
I feel like, and you probably screwed it up by shaving it. It'll never be the same.
This episode is brought to you by The Gross Room.
Guys, we are having our second YouTube live in the Gross Room tomorrow at 12 o'clock noon Eastern Standard Time. So make sure you check that out and join in the conversation with us. And also make sure you check out next week's Celebrity Death Dissection of Hulk Hogan. And actually this week, I don't even know if I mentioned this, that we did Malcolm Jamal Warner as well. So check those out in the Gross Room.
Yeah, head over to thegrossroom.com now to sign up. Okay, so this woman wrote in The Guardian how she was visiting Tokyo from Thailand. She said around 7:30 at night she went back to her room and she was like just settling in for the night as people do. She got a sweatshirt on, but she wasn't, I doubt she was wearing pants. I think she just said she's wearing a sweatshirt and underwear, right?
Yeah.
So she's sitting in her bed. She said she's looking through the train schedule, just chilling out. And about 20 minutes after she got back to the room, she started smelling this really weird smell, which she described as a dead animal covered in sugar. How
This is like-
disgusting is this?
I was like, this is how Lillian describes things. She told me the other day that she said the cat smelled weird, and I said, why? She goes, I don't know, she's just been smelling different. And I'm like what? Like, is she not cleaning herself? Like what? She goes, I don't know how to explain it. And then she says, I don't want to tell you how I explain it because you'll make fun of me. And I said, just tell me. And she goes, she smells more hairy.
And now
And I'm
you're
like,
on a
you're
show
right.
with thousands of people listening where you're making
She just
fun
has-
of her.
She just describes smells in very bizarre ways. One time she said that something smelled bad and it smelled like mustard in a box. I'm like, okay, like whatever. But that's like how specific to be like dead animal covered in sugar. Like it's just bizarre.
Mustard in a box is pretty specific odor. Okay, so she says she starts smelling this dead animal covered in sugar. So she's looking all over the room. She can't figure out where the smell's coming from. And she goes, you know what, I'm going to look under the bed. And she even said she thought to herself, hope nobody's under there. Well, guess what? Somebody was under there. So she cranes her neck to look underneath and sees the eyeballs of a man, like, looking back at her. What's even scarier is he got out really quickly and obstructed her from getting out of the door. So she's, like, in her sweatshirt and underwear, standing in the corner of the room. She starts screaming. She says he starts screaming. And then finally he runs out the door and disappears down the hallway.
I never even thought of this.
No.
Really, I just never did. And now you're like, oh, cool. I guess you should check the little closet they have for you to hang your stuff up in, too. I'm sure this isn't the first time that this has happened.
No, it's definitely not. I feel like I don't know. I feel like when you check in a hotel, like the closet doors are typically already opened. So I don't
Maybe.
know. But I would never think to check under the bed. I, in my mind, feel like most hotels have those bed frames that just go to the floor, you know?
Yeah.
But I guess this is a possibility. I would certainly never think it. If he didn't smell so bad, would she have even known he was under there at all?
I don't know. And she said that he had, I don't know what he had with him, some kind of weird battery pack. And whatever he had with him, she assumed that maybe he was trying to like record her or something.
Yeah, which is really scary to think. So she calls the police and, you know, they just don't really seem too concerned about it. They're saying there's not very many cameras in the hotel, so it would be hard to track him down. She said while they were in their screaming match, I guess, with each other, that she was staring at his face, trying to memorize all his features, which is such a smart thing to do if you get attacked or anything, or just are part of any crime. But then they never asked her for a description of him, which must be just so unsettling that they just seem totally unbothered by this.
Yeah, exactly.
She doesn't know how he got in the room. She was really scared. She doesn't know how he knew she was going to be alone.
Oh my
So
God.
was he following her
know.
outside?
I don't know. I think I would definitely leave that hotel at least.
Well, she did leave the hotel. She got a room in a new hotel where she made the staff stay while she checked the entire room, which totally understandable in my opinion. But she's saying basically at this point there's not much information or any updates about her case because it seems like they just blew it off. It's so scary to think about. Ugh. I always see these videos online, like on TikTok and Instagram, of like these women, like what to do when you're staying alone in a hotel room. And it's like shoving a chair, putting a
They're so
ponytail.
lame, though. It's like put a pair of men's shoes out in the hallway so a guy looks like they're like. It's just those things annoy the shit out of me.
I don't think all that's necessary. I think that maybe check the closets and now under the bed, and then just make sure the door is properly locked. Like, you don't need to be like propping up furniture and all this crazy stuff under there. But it is really scary. This is totally like worst nightmare, and I'm always going to think about this now when we're staying at
Exactly.
hotel rooms. All right, let's wrap up with this story. So, we reported a while back about a surgeon who removed the wrong organ, which truly seemed unbelievable at the time we reported it, and it's happened again.
So the case that we reported last year was that a guy was supposed to have his spleen removed, and somehow the surgeon accidentally removed his liver, which I don't even understand how that's possible. And it happened again. And this is another case that I'm like, I don't even understand how this happened. So basically, this woman had an ovarian cyst, and she went in to get laparoscopy, which is when they put a couple incisions in your belly and they stick a camera in along with surgical tools, and they're able to pull it out through a small incision. And this type of surgery is done very commonly on people with ovarian tumors because or an ovarian mass, because it's not as invasive as having to cut open their whole belly to go in, because healing from that surgery is just so much harder to do. So sometimes they're able to go in and grab it and pull it out without having to make a huge incision, which is what they did in this case. She had the surgery done and she went home and she was having such bad like pain, bloating, difficulty urinating. So it was bad enough that she went back to the hospital and was thinking that she was having complications from her surgery. So the first thing that any of the doctors going into the hospital are thinking are like, okay, it's possible that the doctor had perforated one of her organs accidentally during the surgery. Like something isn't right according to this woman's symptoms and everything. So they decide they're going to do an emergency laparoscopy, which is when they open you up or they go in with the scope and they look. That's a laparotomy, is when they actually open your whole belly up. But with the laparoscopy, they're just going in with the camera again, just to look around to see like if we could see anything that's like glaringly obviously causing this lady a problem. And when they go in, they realize that her bladder is missing. Like a large portion of her bladder is missing, to the point where they're like, this guy. So the other surgeon calls in a friend and says, is this what I'm really looking at right now? Yes, it is. They both agree that like a large portion of her bladder was removed, and so much of it was removed that they weren't able to take what was left of it and repair it together to make it whole again. Because your bladder it's a hollow organ that your ureters from your kidneys empty urine into, and it stores the urine until it's ready to get released. Well, when you're missing that intact hollow organ to hold the urine, then you're going to have all of these problems with your kidneys and everything. You have to have something that's functioning to get the urine outside of your body, and that communication was gone. So they immediately called pathology and said, when this surgeon did the surgery the other day or yesterday, whenever he did it, what tissue did he send down? Did you get ovarian tissue? Because he was supposed to remove an ovary. Well, they look under the microscope and they're like, no, it's full thickness wall of the bladder. Like he took out her bladder instead. So the ovary cyst is now still there. And now she is missing a bladder, which has led to multiple surgeries. She's gotten multiple kidney infections. She had to have another major surgery where they take a piece of the bowel and they actually reconstruct a bladder out of it, which is something similar to what they do with patients that have bladder cancer that have to have their bladder totally removed.
I just really am having a hard time understanding how this happened, because like when I just got surgery a couple months ago, I had at least 3 people, the surgeon and like 2 other people, I guess a nurse and somebody else, come in, and confirm with me the procedure I was having done.
Oh, I don't think it was because they did the wrong procedure, because what this was just botched, not knowing what they were looking at anatomy.
But what I'm getting at is, like, if all those people are confirming with you what procedure you're getting, aren't those people in the room also watching said procedure get done that nobody at any point was like, what are you doing?
Well, this is the thing, though. Like, if you're a surgical tech, and not saying that nurses and surgical techs don't know what they're looking at, because clearly there are some that probably could do a better job than the surgeons could do. But number one, you're like a low-level employee compared to the doctor, so you're not going to argue with what they're doing, because a lot of times, trust me, in my situation in pathology, I used to argue with doctors sometimes and tell them that they were wrong, and it doesn't go well if they don't want to hear that, right? But number two, like, they're not trained on the level of the surgeon, and they, like, I talk about this all the time in the lecture that I just gave in Atlanta, how, like, things look a certain way. When you take gross anatomy and you're looking at fairly normal anatomy and you're looking at illustrations, it shows you the normal way that a uterus and ovaries should look. But once you get pathology and you get in the abdomen, either at surgery or autopsy, everything looks completely different. And if she had a big enough ovarian cyst, it could have been like stuck to the front of her bladder, and it could have even mimicked her bladder and looked similar. And the doctor might have thought that the bladder was actually the cyst. It was a mistake on his part. It wasn't like, oh, he went in and took out her bladder by accident. Like, it seems like he honestly thought he took out this ovarian cyst and took her bladder out by accident.
This is terrifying.
And didn't even and the reason I know that is because you would never approach taking out a bladder with laparoscopically, number one. And number two, you would close it up in a certain way, and you would have a backup plan, like, okay, well, what's going to be used for the temporary bladder until we're able to reconstruct one, or they have it set up so, because you're constantly making urine, it has to come out of your body all day, every day. So they have to figure out a way to get your urine that's being created in your kidneys out of your body. And that doctor just like ripped out her bladder and like left her there to just like have all these unopened tubes like filling up in her abdominal cavity.
Well, I hope this guy is still not, like, he's at least on hiatus or something.
Well,
while they're
he got
investigating
fired,
this.
which is like, I guess, reassuring. But I mean, this is why medical malpractice is worth it, because cases like this is not frivolous. This is changing something. Like, she had a laparoscopy to remove an ovarian cyst. There's always going to be complications that are unavoidable. Like, you can get infections from getting surgeries. That's really nobody's fault. Or you could have a bleeding issue that maybe, again, is nobody's fault. But like, this is an unforeseen complication due to negligence, and this woman's life is forever changed. And I always think this, since the beginning of me working in pathology, thinking about having bladder cancer and what a terrible thing that, like, when you have an organ that has to be used all the time, that has to be surgically removed and replaced, like, what a different change of life that would be for you.
Yeah.
And he shouldn't have even been near her bladder. Like, it's just bizarre. But
it's very weird.
It is. But this is what happened. And like I said, like, a surgical tech in the room might just not have like noticed. She might have noticed and been like, I'm not going to say anything, because like, he's the expert, I'm not, you know?
Yeah.
And ultimately it's not their responsibility. Like, they don't know for sure. They're not trained in that.
God, it's just like, I'm sure anybody that's scheduled to get surgery now is like super paranoid about it.
Right.
But of course, these cases are rare, so let's try to look at the positive side there. All right, guys. Well, we will see you at CrimeCon in September, from September 5th to the 7th in Denver, Colorado. Please leave reviews on Apple or Spotify and subscribe to our YouTube channel. And if you have a story for us, please submit it to stories@motherknowsdeath.com.
Guys, see you. Have a good weekend, and tune in to the YouTube Live in the Gross Room tomorrow at 12 noon East.
Bye.
Bye. Thank you for listening to Mother Knows Death. As a reminder, my training is as a pathologist assistant. I have a master's level education and specialize in anatomy and pathology education. I am not a doctor and I have not diagnosed or treated anyone, dead or alive, without the assistance of a licensed medical doctor. This show, my website, and social media accounts are designed to educate and inform people based on my experience working in pathology so they can make healthier decisions regarding their life and well-being. Always remember that science is changing every day, and the opinions expressed in this episode are based on my knowledge of those subjects at the time of publication. If you are having a medical problem, have a medical question, or are having a medical emergency, please contact your physician or visit an urgent care center, emergency room, or hospital. Please rate, review, and subscribe to Mother Knows Death on Apple, Spotify, YouTube, or anywhere you get podcasts. Thanks.